IVF is an amazing technology that stands for in vitro fertilization. And the simplest way to explain that is it's the process of removing an egg from an ovary, getting sperm from a testicle, and combining them in the laboratory to create an embryo. When it comes to IVF treatments, our clinic practices the standard of medicine which most good clinics will practice. The thing that makes us unique compared to other centers is that we go through that process in a way that is individualized for every patient who comes into the center, and is done in a way that is the most patient-friendly that we can. Some of the people who can benefit from it are couples who are suffering from infertility. They're not able to conceive for a variety of different reasons. It's really a matter of listening to each individual patient to figure out if IVF is the right thing for them. The patient will call when she gets her period and usually come in somewhere between the first and the third day of that period. At that point, she'll have a baseline ultrasound, where we look at her ovaries, do some blood work, and we will generally have already ordered the medication that she has. We'll give her instructions on how to use that medication, and then that evening of usually the third night of her cycle, she'll start the medicine. And then over the next 12 days, she'll inject that medicine on a nightly basis and come in for ultrasounds and blood work every 2 to 4 days. And during those ultrasound and blood work, we'll evaluate the ovaries, check the follicles, and adjust the medication as appropriate based on the findings. Usually after about 12 days, we then schedule a procedure under anesthesia where she's sleeping. It's wonderful rest. And we direct a needle into each follicle that had been growing in the ovary. And we drain the fluid out of the follicle to get the egg. Once we get the egg, we look through the eggs to find the eggs that are mature, the ones that are ready to accept sperm. And we combine sperm and egg together in the laboratory to create an embryo. That embryo then would grow over the next week in the laboratory. And usually after a week, about half of the embryos are at a stage where they're ready to go back into a uterus. And those embryos, which are made of 130 cells, we generally will remove 3 cells from each one of those embryos and freeze all of those embryos. And those embryos that are frozen will now stay in our lab for safekeeping. And the cells that we removed then get analyzed so that we can tell which of those embryos from where the cells came are genetically viable and have the appropriate number of chromosomes to become a healthy baby. IVF can be an emotional process. It takes a lot of time, a lot of effort. There's significant vulnerability that people are exposed to while they're going through this. Hopes and dreams are right out in the open, and that can be a scary time. So the way that we support that is first by acknowledging it, that it is scary, that it can be a emotional process. Then once we acknowledge that, we support each patient at the place where they need it.